Hi, everyone. Maryssa here, and I am with a dear colleague and friend, Miss Alexa Hoffman, who is an occupational therapist. So, we are going to be talking today all things related to occupational therapy and working with young kids with disabilities, and also concerning delays and other those who are at risk. So, I'm going to go ahead and pass it to Alexa and let her introduce herself and tell a little bit more about her background.
Sure. Hi, everyone. So, like Maryssa said, I'm Alexa. I am an occupational therapist in the Philadelphia region. Um, and I've been practicing for about 4 years. After undergrad, I was in social services for a little bit and was initially introduced to occupational therapy through the early Head Start program that I was working with. And it seemed like such an amazing blend of being able to work directly with kids as well as supporting families, while also looking at not only the child but the family dynamics from like a holistic perspective. um, so after working in social services for about 3 years, I went back to school, and like I just said, I've been practicing for about 4 years. And so for me now, I have been working with, um, I work with medically complex children. I have some experience in pediatric long-term care facilities. Currently, I'm in a transitional group home. So with transitional group homes, they differ a little bit from pediatric long-term care because they specifically look for families and children that want to be reunited, and that medically could benefit from being reunited in the community, but they're just not quite medically stable enough. So we primarily get children in that program who are have very early gestational ages, so usually like 24, 25, 26 weeks gestation, and who are ventilator dependent with usually some other either pulmonary or less frequently, but sometimes cardiac conditions that can impact not only their medical development, but also their developmental.
Great.
And
I'm managing a barking dog in the background, so you just keep going.
and so I do that a few days a week, and then I also do pediatric outpatient, again, in the Philadelphia region. And so at pediatric outpatient, I will get children who are usually between ages like 4 to 7. That's my primary age range. Every once in a while, especially with the pandemic, for some of the children that needed more hands-on support, we got referrals for a decent amount of younger children, but I'll also work with children or adolescents up to about 16, 17, working on more life skills.
Great. Thanks so much for giving us the background. Hold on for 1 second. I'm going to pause this. Hold on. All right. Thanks, everyone. Alexa, thanks so much for giving us background on your current workplace, what you're doing, and a little bit of how you became an occupational therapist where you are today. So I wanted to bring Alexa here to share a little bit about sort of maybe some warning signs or some red flags that we may see in young children, in that early intervention, early childhood stage, sort of birth to age 6, and sort of, maybe what the warning signs are those red flags, and sort of any suggested steps or things that we can sort of do as educators to kind of make sure that children are able to get the services that they need.
Yeah. So I think from an occupational therapy perspective, again, so we are looking at what is important for a child to be doing independently. So if we're really looking from that perspective, we're thinking about children, from birth to about 5, their primary means of learning is play. So if a child is having any difficulty in how they are navigating play, especially from like a fine motor perspective, so are they using appropriate and functional grasp patterns to engage in a variety of materials? Once they have grasped an object, how are they manipulating it in their hands? How are they using both of their hands together? Are they able to use their eyes and their hands together to use an object in, or a play object in, a functional, appropriate way. So I think for that age, that's really where we initially step in and look at how we might be able to better support a child. And again, with occupational therapy, play is a huge thing, but also self-care. So how is a child moving through more of that independent stages of becoming like an independent dresser, independent groomer? Are they tolerating brushing their teeth? Are they able to eventually be able to manage buttons and zippers? And another big part of self-care is also, and play as well, but how are they understanding and interpreting all of the sensory information within their environment? So are they tolerating messy play? Not only messy play, but are they able to explore like age-appropriate foods with their hands, right? Because in order for a child to be able to be an independent eater, they have to be able to explore with their hands before they can bring it to their mouth. Are they able to take in and weed out like appropriate auditory stimuli? Are they able to move their body through their environment in a functional way? All of those sensory based things we're also considering as well. So I think I think in terms of warning signs, I think you ultimately just like want to follow your gut. If something seems a little bit off, and this is actually, we do at the outpatient pediatric center, we do training with the pediatric residents, and our pediatric outpatient team is a huge advocate of not wait and see, right? Because if you wait and see and there is actually an issue, kids want to navigate their environment. And if they're not able to do that in the way that they are expected to, or the way that they really want to, right, that can lead into behaviors. They can become frustrated. And it's always so much easier to teach a child as opposed to helping a child unlearn a skill. So we always try to practice not wait and see, but let's look at this and let's look at this further and come up with a plan.
Great. That's, I think, really important information, because I think a lot of families hear that. And I think a lot of educators hear that, as we consider, well, they're transitioning to a new environment or to a new classroom and peers and just a different routine. It feels like that maybe, happens a lot within at least classroom setting. So that's a nice perspective to hear in terms of how we can better support kids and their families.
Yeah, absolutely.
Yeah, great. So before, kind of going back to sensory, you were mentioning, we have lots of, we look at the diagnoses and the numbers of kids on the autism spectrum or other sensory processing delays or challenges. So can you talk a little bit more about that and sort of what could be helpful for educators?
Sure. So can I ask a question?
Yeah, of course.
Sorry. Do you still want to?
Yeah, we can keep recording. Yeah.
Okay.
Yeah.
So I guess tell me a little bit about what like early childhood educators' understanding is of all of the different sensory systems.
I think it's fairly limited. So okay. I think, we do cover a little bit in this class, and then other classes, they make it information. There is an autism spectrum certificate that students can have, but that's optional. And that's integrated into the program, but that is optional. So there's only a number of students who do that. So I think if you could maybe start in a more simple way, that might be helpful.
Okay. All right. Yeah. So when we're looking at a child who comes in to either the clinic or that you're meeting in the community for the first time, you want to look at how they're taking in that sensory information and how they're responding to it, right? So if we think about if we think about like kiddos as they turn like 12, 18 months, they're starting to lead with their vision, and they're starting to lead with their auditory systems to explore their environments, right? But if you are working with a child who becomes incredibly visually distracted, or who can't filter out the important auditory information they need to complete a task, right? There may be some discrepancies there that do impact how they are functioning. And then for younger children, we're really looking a lot at like their vestibular and their proprioceptive systems. So like children, especially children who are preterm or who are medically complex, spend a lot of time in the hospital, right? When you're born, at full term, your vestibular system is usually one of the most mature sensory systems. But when it's not used appropriately after being born, kids and babies can become really resistant to movement. So how are they learning to move their body, but are they defensive when they're being moved? Another really important one, especially for babies, is the tactile system. So again, that's one of the vestibular and the tactile systems are the most mature at birth. And if they're not activated in the right way, kids can become really averse to touch and to movement. So how are they exploring new textures? How are they responding when you are positioning them? Those are some things that we really look at and try to work through if there are some differences, or if it's starting to impede their ability to engage in play, engage in self-care.
Great.
That answered the question.
That did. And I think, it definitely goes deeper. And I think it's helpful too, to hear a lot about like babies and our young ones, because, we do have classes that sort of focus on preschool and kindergarten, and we also have ones in early intervention. But I think sometimes our babies sort of get overlooked. So this is really important conversation. Yeah. So, I'm trying to think of like what other information we can ask of you that would be really helpful. So for those who are, you talked about the red flags, you talked about the warning signs and some other things to kind of look for, but in terms of collaborating or partnering with OTs, or, collaboration and teaming, I know oftentimes is sort of somewhat personality in terms of, wanting to be willing and able to team with others, but is there anything that you think would be helpful for, early childhood special education professionals to know with collaborating with OTs, or what that could look like? Because I think sometimes our expectations are a little bit different than the reality of sort of what happens.
Yeah, well, and this question, Maryssa, makes me think of what we were talking about last weekend about how like teachers for the visually impaired and occupational therapists, again, because of our understanding of the sensory systems, is like vision. Vision is so crucial to, or it can be so crucial to how a child is understanding and engaging in their environment. And I know this is like a specialty area for early childhood special education, but teachers for the visually impaired and I think occupational therapists can work together really nicely. Because we are both looking at vision, but from two different perspectives that you really need in order to treat a child holistically. Excuse me. Excuse me, sorry. I think another thing that I always find super important, especially when working with younger children, is making sure, right? It's so easy, and I find myself doing this in my practice. It's so easy when kids get younger to want to encourage them to sit and play. But realistically, like kids are moving, if they can, kids are moving their body nonstop, and that's appropriate, and they should be doing that. So I am constantly challenging myself to meet a child where they are in terms of their movement skills. So if it's a young baby playing in prone, excuse me. playing in prone or doing tummy time activities as a part of my therapy session. Incorporating crawling or pulling to stand in order to engage in the fine motor tasks that we're looking at. So I really think that in terms of like working together, or what I would maybe recommend is challenging people to meet kids where they are, like motor wise, because it's always the most appropriate.
Yeah, that's really helpful, because I think we have these like somewhat, child initiated or child and play based classrooms and programs. But at the same time, we have our like set sort of areas, and sometimes you can only have so many kiddos in an area, and during like a center time or, free play exploration time, but kids should be constantly basically moving if they're able to, from area to area, as they get more engaged or they see something that's sort of of interest to them. So I think that's important, and teachers are going to be getting all their steps and their active minutes in, following their kids around.
Yeah, exactly.
Exactly. Yeah. Awesome. So is there anything else that you can think of that will be helpful for early childhood special educators to know? Majority of students in this class are kind of going in the special education direction, working with young kids with disabilities and their families, and families being a huge component of our program. But is there anything else, maybe, working with families sort of as a team, that would be helpful to know, either within like a early childhood program or within like an early intervention home visiting setting that you can think of?
Right. Well, I think it's always like important to. I had this conversation with a mom the other day. We were doing like a Play-Doh activity with. Have you ever seen like little like food picks?
Yeah.
Yeah.
Mhm.
So we were doing this activity, and I was approaching it from like a fine motor standpoint. And I think, and she, we were talking about like why I was doing this activity, and she was like, oh, well, like I thought it was for like language development and for like following directions, like these cognitive developmental milestones. And it kind of like brought in like a deeper discussion about how across disciplines, we could be doing the same activity, but all of us have different perspectives that we're coming in from. And all of them are really crucial to a child's overall development. So I think that just trying to think of activities where we are meeting multiple goals across disciplines is ultimately not only going to be beneficial for the family, because we're modeling some multi-step activities that they can be doing with the child, but beneficial for the child in the long run too.
Yeah, that is really important. And we do talk about integrated development across domains, and it, not necessarily siloing like cognitive development versus motor communication, but they all are really interrelated. And there are some activity plans that students will be doing where they consider sort of the different areas of development and domains, where they consider sort of what skills that they're working on that are embedded within the activity, and also how to involve families at home, and different adaptations, I guess, or different perspectives of those activities.
Well, and I think you'll so quickly, with that sort of activity that you're planning, you'll so quickly learn that with just like a simple task analysis, you can pull in so many different pieces that you're trying to target, again, across disciplines.
Mm-hmm. Great. Well, this has been very helpful. So thank you so much for joining us. I guess just opening to one last thing, is there anything else that comes to mind that you wanted to share today with students? We just really appreciate your time. So
I think I shared everything, but I would be happy to answer questions afterwards if students have questions.
Okay, sounds great. Well, thank you so much, Alexa, for joining us. And we just appreciate you taking the time to share your wisdom of occupational therapy.
Yes, happy to share.
Great, thanks.